Hello, I'm Rory Bremner. Sadly, we're all too familiar with cancer. We've all seen how it affects our friends, our families, and our loved ones. We always hope there'll be a cure in our lifetime, but the reality is, cancer is on the increase, affecting at least 1 in 3 of us and killing 1 in 4.
Jill was somebody who was just so positive about life and was not going to let cancer affect the way she lived her life and what she did. She was just so positive about life, it was quite incredible. And she lived through cancer and didn't let it spoil her life. And we had a most amazing time.
In our area of Swindon and Wiltshire, nearly 300 people a month are diagnosed with cancer at the Great Western Hospital. Most will opt for radiotherapy as the most effective and successful treatment for their condition. But here's the thing, there is no radiotherapy unit in Swindon. That means that patients face a return journey of up to 70 or 80 miles to Oxford, time that could be spent at home having treatment locally.
Got diagnosed with breast cancer in April of last year, so following the chemotherapy and the surgery, I had to do 25 sessions of radiotherapy. I had to rely on someone else to take the children to school. A lot of traffic, long days, sometimes a lot of waiting up there, and then trying to get back to do work on time. And once I got to work, it was like, okay, I'm here now, I can relax. I've done that bit, I've done my therapy, I can relax for 24 hours, and then it all starts again the next day.
The patients that come in for radical treatment, some of them may come for 37 daily treatments. So we treat 5 consecutive treatments, 2-day planned gap, and then 5 more treatments. So they're travelling backwards and forwards for nearly 8 weeks. That's a lot of miles, enormous disruption to their daily routine, and it puts pressure not only on them, but their family, their friends, and whoever their carers are.
The trip to Oxford is so hard. It comes at a time when you are adjusting to a life-changing thing that's happened to you. The people that end up on the bus to Oxford, they leave at 7 in the morning for a 3-minute treatment and don't go back till 7 o'clock at night. If it can be 10 minutes down the road, it will make people's life easier. And there are people who can't cope with the trip to Oxford and actually stop doing it, which has got to be the wrong thing to be happening.
Linear accelerators are the treatment units that actually deliver the radiotherapy. They basically produce high energy X-rays, and they can be directed to the volume in the patient that we wish to treat. We can actually tailor the treatment so that you're giving a high dose to the tumour volume that you want to treat, but you can reduce the dose to normal tissue. The long-term side effects from radiotherapy are significantly reduced to what they used to be 30, 40 years ago.
That's why we need a radiotherapy unit right here in Swindon to give people the best chance of successful treatment within half an hour of their home. And that's what Brighter Futures is all about. We need to raise £2.9 million to equip a radiotherapy unit at the Great Western. That's about £10 for every one of the 1/3 people living near Swindon who will have a brand new radiotherapy unit to treat them in their hour of need. It's a no-brainer, but we need your support to make it happen. So please give as much money or time as you can to support this great local cause.
If you live in the local area, I don't think there is a better charity at the moment that deserves it more.
So many people have members of family that have been affected by cancer. Just think back to your family members that have been involved with it.
Brighter futures. Let's do this. Let's make it happen as soon as we can. The need is urgent, the cause is great, and the time is now.